Hello, I'm Nathalie Farpour-Lambert from Geneva University Hospital. I'm a specialist in pediatrics and obesity, and I'm the president-elect of EASO. I'm going to talk about the prevalence of obesity and its comorbidities, the causes of obesity, as well as the management of childhood obesity. I'm now presenting the definition and the prevalence of obesity and comorbidities. Obesity is globally recognized as a disease and a health issue, both by the WHO, EMA, and OECD. So obesity should now be treated as any other chronic disease, and more effort should be put to reinforce the treatment and also the prevention of the disease. Obesity is defined as an abnormal or excessive fat accumulation that may impair health. The body mass index provides the most convenient population-level measure of overweight and obesity currently available. The body mass index is calculated as weight divided by height squared in meter. Overweight is usually defined as a BMI over 25. Obesity as a BMI over 30, and then obesity is classified in three different categories. Between a BMI between 30 and 35 is a grade 1, between 35 and 40, grade 2, and over 40 is a grade 3. In children, the situation is different because children are growing, so they increase their height and weight annually. Several definitions have been used to define obesity in children. The first one used was the Cole definition, which has been published in 2000, and which has defined two cutoffs for both overweight and obesity corresponding to a BMI of 25 in adults and 30 for obesity. Later, in 2007, the World Health Organization published new references for the world. And the definition of overweight is a BMI over the percentile 90s or standard deviation score of +1. Obesity is defined as a BMI percentile over 97 or a standard deviation score above 2. This slide shows the present situation in the world. At the beginning, the obesity epidemic started in North America, then in Europe, and also in Australia. But very quickly, the obesity prevalence increased in developing countries. And we can see on this map an increasing prevalence in North Africa, as well as Asia and South America. This slide shows the prevalence of obesity in European countries. We can see a trend toward an increased prevalence in the eastern region of Europe, as well as the Mediterranean countries like Portugal, Spain, Italy, or Greece. The prevalence of obesity has also increased tremendously in the last 2 decades. This slide shows the prevalence of obesity in children in the world. And interestingly, we can see the same distribution of obesity with a very high prevalence of over 30 in North America, as well as in South America, Australia, and Europe. We can also see an increasing prevalence in developing countries like the northern region of Africa or Asia. The OECD data from 2014 show an increasing trend towards an increased prevalence of obesity in children in the southern part of Europe compared to the northern countries. Obesity is unfortunately associated with multiple complications, which may start very early in life. We know now that obesity is associated with cardiovascular disease, type 2 diabetes, as well as many other chronic conditions such as osteoarthritis, cancer, liver disease, sleep apnea, and also mental health disorders like depression or anxiety disorder. Obesity especially contributes to 44% of type 2 diabetes. It also contributes to 23% of ischemic heart disease burden. And finally, 77% of obese adults report some kind of sleep problems. So obesity should be considered as a chronic disease as itself, but also a gateway to chronic disease. Obesity is a gateway for non-communicable chronic disease. The relative risk of developing type 2 diabetes, cardiovascular disease, as well as some cancer, osteoarthritis, depression, asthma, and stroke is increased in the population with obesity. Obesity is also associated with depression. On this slide, we can see an increased risk of having depression when being obese compared to a non-obese population. In addition, obesity affects health-related quality of life. And we know that obesity can both impact psychological health, physical health, and also sexual health in adults. And on this slide, we can see an increased prevalence of impairment in health-related quality of life in all of these three components. The question remains as what is an ideal BMI in adults? And some studies have now shown that an increased BMI in the over 25, it might be associated with a better health and decreased mortality in aged population. However, in the population between 20 and 60 years old, a BMI under 25 is recommended. Obesity is one of the biggest health challenges of the 21st century. Obesity is associated with increased direct and indirect health costs. The health costs can be due to the visits to the physician, to the patient being hospitalized, as well as the spending on the prescription of drugs. Obesity is associated with reduced life expectancy. People who have a BMI in the normal range have an almost 80% chance of reaching the age of 70, while people having a BMI over 40 have only a 50% chance.